For those dealing with endometriosis, a painful condition where tissue similar to the lining of the uterus grows in other areas, day-to-day life can become a struggle. Due to inflammation, symptoms can include painful periods, heavy bleeding, pain during sex, and fatigue. However, there is some good news. It has been found that eating the right foods and controlling hormone imbalance can help the body fight this inflammation, which can improve symptoms. Hormone wellness expert Claire Snowdon-Darling explained how hormone therapy can improve the lives of those with endometriosis.
So we look at hormones not just from the perspective of the hormones. We look at it from where all the hormone issues can come from. So that can come from your blood sugars and diet. It can come from stress hormones. It can come from the sex hormones themselves. It can also come from your gut and it can come from your immune system, or it can come from bits of all of them. And so there's no point just trying to take the pill to fix this problem, or we have to look at all of those areas and make sure that we're giving the body exactly what it needs in all of those areas to give ourselves a chance to get our hormones balanced. Endo is it's such a tricky condition. But where the medical model really miss out is they focus so much on the estrogen aspect of endometriosis. But actually, the research shows that endometriosis is very connected to the gut and to inflammation in the gut, and that there's a lot of the origins even of some of that endometrial bacteria could actually be from the gut. So we are very hot on looking at diet and what foods are inflammatory. So I would say the most effective thing that I have seen is diet. And when people do start eliminating common food intolerances, not just sugar and dairy, but they're key. And it can, depending on how bad your endo is, it might mean you have to go into the more extreme things like the keto carnivores. I would absolutely say you've got to work with a coach who understands it, make sure you're not in any kind of, deficiencies. But once you actually get underneath the inflammation, that's when you can start to reintroduce things. So it's not like a life sentence, and the supplements that go along with reducing inflammation. Yeah, as far as I'm concerned, there is actually a major health crisis because I'm seeing an epidemic of hormonal health issues, not just from women my age and who are perimenopausal, but younger women, your age and younger. That's actually the women that I see the most in my clinic, women who have got horrific hormone problems that were just not present 30 years ago, and no one's talking about it. So, really, what I tend to say when it's an unfiltered is I'm trying to build an army of exceptional coaches who are so much better trained than the doctors dealing with hormonal health so that we can go out and tackle this problem. I think the problem is when we've got a big condition like this, it can feel like, why me? But I still want to go out for pizza with my friends and I just want to be normal. And actually, the truth is, I can honestly promise you those friends aren't going to get away with that kind of for very much longer either. Like there is something in it, like I said, there were in epidemic proportions of people who are unwell. So it isn't just you. And I like to think it's a gift. I've worked with people with terminal illnesses and have passed away and we were working emotionally or something. And every single one of them has got to a point where they've said, this has been a gift. It's made me prioritize the right thing. So it's waking you up to maybe your behavior around food or the conditioning you've had around food. And I promise you it is a gift. And so trying to take yourself out of the victim place and seeing that it can be really empowering, that's where the education comes in, and sort of having a good hard look at some of your behaviors. Are you in good sleep hygiene? Are you just like drinking loads of Diet Coke or things that actually really aren't helping your body? And maybe your body is asking for something different. And like I said, it's not just you, it is an epidemic. And 2025 is a really hard time for the human body to be alive. So we just have to give it a little bit more love.